So I'm back. Just another update. It is now 8 hours, maybe 7 hours past my surgery. I'm talking pretty good. I feel like I'm not really lisping too much. I can actually say pretty much anything. I was able to get my bottom plate back in, and I haven't had any issues with keeping it in. Now, in terms of like my surgery today, there definitely was some issues. They clearly did not believe me when I told them that I was hard to get an IV in. The oral surgeon was absolutely amazing. He did everything he could to try. He, I mean, he for about a good 45 minutes he attempted finding, a good vein on me. I just have very small, very deep veins, very difficult. So it finally got to the point where he was like, look, it's not going to work. The pill isn't going to do anything for you, because I had to get bone shaved down. He said it's going to be rough for you, and we can, maybe schedule to get you to the hospital. I don't know, that word was hard to say. Get you to the hospital to get an IV pre-done, reschedule for the 22nd, come in, do it that way. And he said, do you know where to go to do that? And I was like, no, I don't have no idea how to do that. I didn't even know if that's a real possibility. It's just something I had inquired about when I came in and told your office manager that this was a really big issue. They just didn't seem to understand how serious I was. They kind of didn't listen. So he was super nice, super good doctor. He was like, I told him I'm starting a new job and all that, and he could see that I really wanted to get it done. And he was like, look, if you want to try the pills, I said, I do. I was like, I've already kind of put it in my mind that I was going to have to go through some stuff today. So he was like, well, let's go for it. And he told her to give me 2 halcyons and put them under my tongue. I got my husband to bring my phone in. I put my AirPods in, threw on some Beyonce, and within like 30 minutes I was asleep, knocked out, and I came in and started. The only thing that was painful was the injections, but he numbed everything up. I did not feel not 1 ounce of pain when it came to him pulling all of the teeth, and I had like 23 extractions. And then the bone where they shaved down your bone, I had to have that happen. So I didn't feel that. I honestly feel like I was in a very like sleep-like state, and then the pill is supposed to make you kind of forget too. So I might have forgot anything that did happen, I guess. I don't know. And the next thing I know, they put this in and said, all right, you're done. No, the worst experience I've had so far was on the way home. The gauze had filled up. And my Aspen didn't do what all the other people had done they did give me a little case to keep it in, but I had to ask for it. My bag didn't have like any samples of anything. I didn't get a brush. I literally got 1 piece of gauze in a bag and was like, bye. And my prescriptions. So on the way to the pharmacy, I didn't have enough gauze. I was like, my, for some reason, the bottom plate started feeling like it was like, just the edge of it was just hitting bone. It was like on the side of my mouth. I could not keep it in. I kept having to take it out. And this is like right after we walk out of the dentist, like on a 25-minute ride. And it was horrible. It was really bad. Trying to get to this pharmacy, and It was really bad. That whole ride, just thinking back on that, I had blood all over me. Um, since I came home, I took 2 of the pain pills when this was all happening because it was hurting so bad, and I pulled everything out and rinsed it all off, and I was able to get everything back in, and I've been good since. I've been here all day. Well, not all day. So what? The past 6-7 hours, and right now I'm not in any pain. It's definitely an adjustment getting used to this being in my mouth. I've eaten one icy today, one of these, and I'm gonna eat another one in a minute. But I'm gonna wait for it to like melt because the first one I ate was kind of difficult to eat. Only reason I wanted to eat it is just because it was cold and kind of. They said not to eat 8 hours prior, so I'm starving, and I'm in my bed with my cat. And but at first, when I first got into the car, I hated the color. I hated it. I was like, oh my god, I hated it. They're yellow. Oh, they look so yellow. Now when I look at them, I don't see that. I see that they look pretty nice. They look natural. They look like the whites of my eyes, I guess. Maybe a little bit darker. I don't know. I might be able to get away with a bleach shade, but I'm gonna see how I feel about these, because I'll have them for the next 6 months. I did schedule already to go back on Monday to get some sort of an adjustment made because I don't feel like my bite is right. It feels like it's hitting this side. Sorry for the blood. It feels like it's hitting this side first. Feels like it's hitting harder on this side. It feels like it's like up some on that one. Like it just doesn't feel like it's really seated right. And I think that's part of like, whatever. I don't know because this is my first time having it, and I don't know if like getting a soft liner and all that stuff, or like maybe I have more swelling, maybe I don't know. I really can't see any swelling. The one thing that I will say freaked me out and bothered me a lot is I did take both out to rinse them, and that was kind of shocking to see what it looked like without them in there, and that kind of really bothered me. But I'm actually okay about it. Like, I guess I know that I have this to make me not look like that. And my next goal is I do plan to get at least at the minimum would plan to get the 2 implants and get a locked in one on the bottom, and then I'll work towards the top. But I do plan on getting that done. I do not like that look at all with it out of my mouth. Of course it aged me like 30 years. It was very scary looking. It's definitely still kind of rubbing on this side, so I think the pain medication's helping with that right now. So I might go ahead and take another pill in an hour or 2. Maybe sooner than that. And I'm not trying to get back to that place that I was at when I first came out and the numbness first started wearing off. But overall, Aspen was fantastic. I didn't have any problems with the care. Scheduling, absolutely horrible. They definitely have a problem with keeping their appointments. Um, and and it's more the office staff, and not even the assistants. So it's probably like the manager, maybe not training people effectively. I know I personally spoke to the manager and expressed what I was doing and why I need a contingency plan, and she completely um, didn't take me seriously. Luckily, the oral surgeon still went forward with the pills because he really it didn't seem very comfortable with it at first, but he took a chance that I was determined, and we got it done. Um, so I give all of the assistants, all the dental assistants are really nice, really great people. They were all very caring and helpful. So I would say it's just a little bit of unorganization when it comes to like the scheduling and knowing, what procedure should have been scheduled with who and stuff like that. They maybe just need to kind of reevaluate how they look at that when they're preparing appointments. So to me, it's not end all be all. I've been extremely happy with everything else. I'm happy that I got to have my procedure today because I waited and waited and waited. So, and I'm happy that I actually have this now, and I'm happy that I get to start a new job and be around people. Oh, my phone died. Anyway, happy I get to start a new job, be around people, and just smile again like normal, and wear lipstick to work. That's gonna be fun. Um, but and I do apologize for how busted I've looked in my last couple of videos. So next one I will make, I'll try to make sure that I don't look so crazy. Alright, thanks for watching, and hopefully I'm actually helping someone else who's getting ready to go through this at Aspen. Alright, bye bye.